Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hello, everyone. Welcome to another episode of Balls Deep. I am Dr. Joe Pazona, your host, and joined as always by my lovely co-host, Kat Williams. How are you, Kat?
That's me. I'm good. I'm doing very well today.
Yeah,
it's a beautiful spring day, sunny, and yet I am still cold.
Always.
Always.
Absolutely.
I am wearing a full-length coat are we almost in April?
We're getting there at the time of recording this.
So super weird that I'm in a full-length coat, but it's a beautiful day.
Yeah.
I love spring.
Absolutely. Well, excited for us today. What topic do you have lined up for us?
So I have lined up today talking about incontinence, which affects a lot of women.
Yes.
Not just women, but a lot of people I know are talking about this. Young women, older women, and we have some questions for you.
I love it. This is something that, as a urologist, I feel very strongly about that we're undertreating and we need to build some awareness. So I'm excited to dive right in. And although not necessarily appropriate for an incontinence episode, we can go real deep, though, even balls deep.
Balls Deep.
Okay, so incontinence. Is leaking urine, to try to put it in a nice medical way, is this ever normal? Is this something that just happens as people age? Is this, what is this? I mean, we talk about incontinence. People think this happens only to older women, women who have had children. Who does this happen for, and what kinds of incontinence are out there? Give us some definitions. Give us the lowdown.
So if people don't get anything else out of this episode,
This is it.
this is it. Hear me clearly. Bladder leakage is never normal and acceptable.
Okay.
Never.
Never.
There are too many women who are just suffering in silence. Women are the stewards of the house. They are the stewards of the health care of the family. And so they stoically put up with this leakage, and they don't need to. And it's frustrating, but I understand. You know, listen, I'm a man. It'd be arrogant of me to know what is going on in a woman's life. Beyond my direct observations. But too often we have this myth that is perpetrated from generation to generation. Well, grandma leaked urine and just wore some pads, and then mom did. And well, I'm having a little bit too, but I don't want to do anything about it because that would bring awareness, and that's embarrassing.
But older women especially, I mean, the constant commercials on television for these pads and things, I guess they're geared mostly to older women, but I also have younger friends who are moms who are afraid to jump on the kids' trampoline or even go to an exercise class. But everyone just acts as though this is normal. It's just a thing, and there's nothing you can do about it.
Yeah, and it just couldn't
Completely wrong.
Couldn't be further from the truth. There are things, and you know, just the fact that you see all these advertisements should make you be aware that it's a big issue, because
Right,
there's a lot of
right.
money to be made.
Absolutely.
And so all the pad companies are doing great, but there are so many solutions that are out there. But, you know, before you start talking about solutions, it is important to have some background knowledge and to kind of parse out the different types of urine leakage, because your young moms likely have a separate issue than, say, grandma had when she was older.
So it's not just one thing. There are actually completely different reasons this would be happening to you.
Absolutely.
Okay.
And, you know, for the urologists who may be listening, I'm going to give a very cursory layman's sort of look at this. They're certainly much more nuanced, and there are people who spend their whole career studying bladder dysfunction. So, you know, with that as a caveat, for most of our listeners, we can think of it as two main types of urinary leakage. There are certainly more, but for the majority of people, the first is stress incontinence. And this is not because you're stressed because, you know, your husband's going to play golf and you got 3 kids activities this weekend.
It's not that kind of
It's
stress.
not that kind of stress. This stress is when a woman coughs, laughs, sneezes, or jumps, okay? Anything that causes a stress of the abdominal wall, what we call a valsalva, kind of a bearing down. That pressure is transmitted on the bladder, a stress. Now, what normally happens is when that stress gets transmitted on the bladder, the female urethra, which we've covered in other episodes, is very short little muscular tube, normally has these attachments that keep it in place and it closes shut. So as the bladder gets stressed by jumping on that trampoline, the urethra stays shut. Now enter childbirth, menopause, surgeries, smoking, obesity, things that weaken tissues. And now all of a sudden the stress is on the bladder, but the urethra, rather than staying shut, kind of jumps up out of place.
Okay.
And so now that pressure causes a squeeze of the bladder, the urethra doesn't close shut, and as you say, the TT comes out and a woman now leaks.
Okay.
Thus, not able to exercise, refusing to jump on the trampoline because if she does,
incontinence.
it's a physical issue, right?
Okay.
So that's one main one that typically is going to affect women of all ages, but most of the time a woman's going to see that for the first time after childbirth.
Okay.
Okay.
Great.
Now, separately, although somewhat interrelated, is something called urge incontinence. This is when a woman, or even men can get this as well, there's a signal to the brain of, hey, I got to go to the bathroom. And when things are working, the brain goes, okay, great. I'm sitting in traffic here. I'll be home in 20 minutes. Hold it. And your bladder goes, okay, I'll hold it. And then depending upon how long it is, you eventually go to the bathroom and relief comes. When you have urge incontinence, what happens is the bladder screams to the brain, hurry up, I got to pee. And the brain goes, what? And now the bladder just empties. So the communication pathway between the bladder and the brain here is off kilter. They're not in good speaking terms.
Okay.
And so this is when a woman goes, you know what? I got this really strong urge. I started running in the bathroom and I just wet myself before I got there.
And she didn't make it.
Exactly.
Okay.
Or I'm driving up the driveway and I'm so close. And the second I step out of the car and put the key in the door, I wet myself. This is often associated with, say, an overactive bladder. So people who wake up a lot at night to go to the bathroom have a lot of daytime frequency and urgency. And when it gets really severe, they actually wet themselves. So it's important to sort through those because they each require different treatments and different approaches. But most women just come in to see me or a colleague and go, I'm peeing my pants, help me. And then they may share a story of, hey, my girlfriend had this. What are your thoughts? And I go, well, sounds like she probably had A. You actually have B.
Well, okay. This is great to know. I'm not sure that I had an understanding that there were 2 different kinds of leakage situations at all. Certainly didn't understand which was which, and now I do. But is it fair to say both, or is one or the other treatable? Is there bladder leakage we just have to live with? You've said it's never normal. So what can we do? And does this apply to each type?
Absolutely. There are things we can do. Now, again, a concept we keep coming back to is that, listen, there's no all or nothing. And there certainly are some women who have gone to see experts throughout the country and are still leaking. There's no doubt some really challenging cases. But for the large majority of people who've never sought treatment, very, very often there's things we can do.
And this is outside the scope of having to wear these pads and things that are advertised constantly to us on television as though that is the best and only option, which can't and is not a good option. No one wants to work with that.
No.
If there's any other solution, that would be at the bottom of the barrel.
It should be. Unfortunately, it's the go-to one because, again, due to awareness and due to fear. So let's try and build that awareness of the options and relieve some of these fears. So let's first start with the stress incontinence. So again, understanding that in that case, it's a physical issue with the urethra. It's a muscle issue. So you'd imagine there really are not medications or things that you're going to do that are going to, quote, strengthen the urethra unless you physically strengthen the urethra or resupport it.
That makes sense.
So this is one of those cases where what you're drinking, pills, things like that are probably not going to help. So most women have heard of doing Kegel exercises, right?
Yes,
the pelvic floor.
we've all heard of the
Right,
Kegels.
so
Yes,
do you know how to
yes.
do your Kegels?
And no one does this.
And well, people do them. Do they do it as effectively as they could? Probably not.
Probably not.
And just as we all know that you can get better results in a gym with a good trainer, you can have better diet results with someone planning your meals. When you work with a pelvic physical therapist, someone who is trained and understands the muscle and the anatomy of the pelvic floor.
I'm not even sure that I knew this person exists. And I'm a very big into, personal trainers and physical therapists. There is a pelvic physical therapist. This is
100%.
a thing.
They are angels
Wow.
in our world.
Okay,
And
wow.
thank you to all you pelvic physical therapists out there.
Ladies, everybody, there is a pelvic physical therapist. This is a person.
And they can work great things. Now, if you're a woman who's soaking a couple pads a day, you have really severe leakage, is pelvic physical therapy going to be your cure? Probably not. But for a lot of those moms out there who are just suffering in silence with, this bugs me, but I just won't jump on the trampoline, or I'll wear that little liner when I do my Zumba class.
Right.
Doing some good pelvic physical therapy with someone who is trained in it can absolutely make a big difference. And so we actually, with our practice, we partnered with a urogynecologist. So someone who is really, this is what all they do. They live in that world of female bladder health. And they developed a virtual program that our team helps guide women through. And so women can actually do this if going to an actual in-person therapist is a challenge, whether it be due to
maybe you're not close, maybe there's no one in your community,
or you're a busy career woman and a mom, and you just don't have the time to go. You could do this on your own schedule. So physical therapy can absolutely help, but don't tell me you've done your Kegels and that's the best. Okay. So then we can look into more of our procedural options. And so there's really, again, lots of different options, but two big categories. So one of them is a procedure that's done in the office. It's called Bulkamid, and it's by this company, Axonics. And I don't have any financial ties with them whatsoever, but I do believe in their therapy for women. And essentially, it's as easy as driving into your dermatologist and getting some Botox needles. We do the same thing down there in the urethra where we put in some filler. It takes 10 minutes. We get women high on laughing gas. They drive in wet, they leave dry.
I think everybody must be under like the impression or the misunderstanding that this is some kind of a, quote, surgery. You have to go in to have a surgery. But we'll go have a, quote, procedure anytime at the dermatologist. I'm over there several times a month. But it seems really, really simple. And I wonder why more women are not jumping in on that kind of a simple procedure.
Well, it starts with awareness, right? I think
Okay,
there are a
they
lot of
don't
people
know
out there
about
who
it.
just don't know about it.
think
And
that's
if they
fair.
do, they don't know where to go. And then there's, again, this fear of something bad happening or admitting like you're a bad person because you leak. And that's why, to me, again, it's so key to normalize these discussions and realize it is not normal to leak and we need to speak up about it. And that's what I want to get across. So I think it's that fear that if I admit I've done this, I'm a bad person. Yeah, and I'm just supposed to live with it because mom lived with it.
Or the fear that there is nothing to do.
Correct.
There is no solution.
So that's an option. What's great about it is there's minimal downside risk. Women within a couple days at most are back to full activities. Again, they can drive themselves to and from the visit and get this done.
And this is simply an in-office procedure, and it is for lack of a better way to explain it, a filler.
Yeah, absolutely. And now that probably helps ballpark 70 to 80% of women. And so again, if you're really severe, if you're looking for that, I want the one and done sort of thing, maybe that's not the best option, but again, it has little downside.
Mm-hmm.
For women who are looking for more of a cure, something with a higher success rate, there's a procedure that gets a dirty reputation called a sling.
Oh, I remember this. I remember everybody going crazy and hearing the negative talk and publicity about the sling. Tell us more about what's happening with that currently.
So let's explain what a sling is and why it got kind of dragged through the mud unfairly.
Mm-hmm.
So a sling typically is made of some mesh material, synthetic mesh. Okay. And you see all these lawyer ads. If your doctor put mesh in you, call me and we'll sue them and we'll get you millions of dollars.
So many lawyer ads.
Unfortunately, where that came from was in the 2000s, there were some products in the market that were mesh procedures that were billed as minimally invasive ways to treat something totally different, something called prolapse, where a woman's bladder was sagging through the vagina, something called a cystocele, and their bladder was dropping, and they build this minimally invasive new therapy with mesh material to put things back in place. Well, the problem there was they were using large pieces of mesh that gave surgeons millimeters of margins of error, and all of a sudden put a tool in the hands of people who are not well trained at doing it. So,
recipe for disaster.
100%. Unfortunately, because most people don't even know the difference of anything, and they just know, I don't know, the doctor
mesh is bad.
Mesh is bad, and the doctor did something down there. I don't even know what it was or for what.
Mm-hmm.
I just know he said I had to have it, right? And now all of a sudden, all slings are bad. So if we look at the current slings, the chance of a mesh complication in the right person's hands is 4 out of 1,000 procedures.
So incredibly small.
0.4%. And most of the time that's going to happen because you went to an inexperienced surgeon or you had some risk factors for having an issue. Smoker, previous radiation, very low estrogen levels. There were things that were going on with your body that made it more likely. But most of the time, for most of these young, healthy moms out there, to go in and have this procedure, it's a 10-minute outpatient procedure. There's no external cuts. We put you under general anesthesia, so you're asleep for it. And we make a small little incision inside the vagina, put in this mesh that kind of acts like a hammock. I like using this new single incision one, so there's no exit wounds or risk of injuring other structures. And usually after a long weekend, women are pretty much back to normal.
And this helps
90+% of people.
90+ is a pretty good percentage.
Yeah. So, and again, it absolutely has risks, and don't take this to say that all surgeries are good. You need to have an informed consent with the doctor that you trust and walks you through the pros and cons. But for a lot of women, this can really make a difference. So again, as a quick review for the stress incontinence, we've got that Bulkamid or filler, and then we've got the sling, 2 very safe, very effective options to help that bladder leakage.
That have nothing to do with horrible pads.
Correct.
That is excellent, wonderful news that I hope everyone will hear. One other thing I wanted you to discuss is, there are consequences to ignoring bladder leakage. There are consequences to pretending this is just something that happens to you as you age or after you have children. What are the consequences? What are the possible downsides of just letting this go?
Yeah, definitely. And I think this would be a good tie-in because I want to make sure we at least briefly cover we covered the treatments for stress incontinence, but didn't cover the treatments for urge incontinence, but this ties into the last part. So if we think of a woman who has an overactive bladder, waking up a lot to go to the bathroom, okay? So we just ignore it. We're stoic. We wet ourselves sometimes. We wear our pads. We wake up 3-4 times a night to go to the bathroom because that's just, quote, normal. It's not. So now mom's in her 70s or 80s. She wakes up 3-4 times a night to go try and get to the bathroom so she doesn't wet the bed. It's dark. She's not as strong as she once was. She trips, she falls, she breaks her hip.
Yikes.
The mortality of a hip fracture when you're 70 plus approaches 50%. That means at a year after a hip fracture, half the people are dead because they broke their hip. And what was the root cause? They were waking up at night to go to the bathroom and we could have fixed it.
That's sort of an unbelievable statistics about the hip, but wow.
Yeah.
I would never have put those two things together, but that's a pretty interesting scenario.
And so again, it shows how healthcare is complex, and shows how when we are stoics and we ignore certain things that are like, this isn't important, how really it can be really important. Never mind the lost years of quality of life because you didn't go hang out with your girlfriends because you were worried you're going to pee your pants, right? So when we talk about an overactive bladder, this is a bit more complex. And again, I could talk for an hour about all of that, but just as a brief overview, again, we've got a communication issue between the bladder and the brain where the bladder is just squeezing too often and sometimes so strongly you wet yourself. This is where we do a deep dive into your history, where we screen you for your caffeine intake, your alcohol intake. It's amazing how often people are peeing too much and they're drinking too much. And that certainly, drinking a lot of coffee isn't going to make you pee your pants, but it's going to exacerbate it. Okay. We go into other medical issues. Could you have multiple sclerosis? Could you have Parkinson's? Could you have some neurologic disorder that's contributing to this bladder issue? We then kind of talk, again, lifestyle. We want to make sure your bowels are working, you're drinking the right stuff, you're going to the bathroom proactively rather than waiting for that urge to happen. And when those things don't work, again, we have very effective, minimally invasive options. So we jokingly talked about Botox before. Well, guess what? We do bladder Botox. And it works.
And it's easy.
Yeah. I mean, Botox, how's it making, lovely ladies continue to look lovely? It's paralyzing muscles and preventing wrinkling. Well, in this case, we want to paralyze the bladder muscle just enough so it's not so overactive. We also have this incredible therapy. Same company as before that makes the Bulkamid has a product, and it's called sacral neuromodulation. Bit of a mouthful for those out there. Sacrum is the part of the spine and sort of the back right above your tailbone where all the nerves going to your bladder live. Neuro means nerve, modulate means to change. So basically, this is a pacemaker for someone's bladder.
But that sounds like a bigger surgical procedure, is it?
Well, it really isn't. So the beauty of it is we can do a trial period in our office. It takes me under 10 minutes.
In your office?
In my office. No cuts, no incisions. I jokingly tell people I can't hurt you if I tried because we're literally putting small little needles in a safe place that honestly getting an IV in your arm or a catheter placed is more dangerous.
Wow.
And this trial period can often just change these women's lives. I mean, I'd say of all the things I treat in urology, fixing bladder leakage is hands down the most rewarding because you're giving someone their life back. And there are these therapies that people don't know about and sound scary. A bladder pacemaker, Botox, slings. Oh, but when you actually get counseled on it, when we're able to show you some videos and pictures and have you talk to people, they're really easy and they help so many people. And again, it's not for everybody, but I want people to leave here today understanding that you don't have to suffer in silence and that these things make a difference. And that when you do suffer in silence as you get older, that can lead to bad health problems, whether it's a hip fracture or even something more likely. Let's say you are that young mom and you're going to not jump on the trampoline, but you're also probably not going to go to your exercise class. You're going to be embarrassed. And so now your physical activity suffers. So now you're starting to put on a little bit of weight. And then that snowballs. And 20 years later, now all of a sudden you're a diabetic.
So this is a domino effect.
Absolutely.
This is a real domino effect.
And so I can certainly empathize and appreciate why a woman would not want to work out if she's wetting herself. What I'm telling you is you don't have to sit there and live with it. that should not be limiting your ability to be well and be the best version of yourself.
I think this is amazing information because I can't tell you how many people I have talked to and they blow it off. They're like, no, I'm good. And I say, there are things you can do. They're like, it's not that bad. It's okay. I can't sneeze. I can't laugh. I can't do any exercise, but it's okay. And I'll just live with it, which seems ridiculous.
Yeah.
Certainly given all of this wonderful information. Well, thank you for sharing all of this. And ladies, talk to your urologist. There are absolutely things to do, and you don't have to live like this anymore.
Absolutely. Well, Kat, let's jump into your favorite segment.
My favorite section.
And summarize what we learned today.
Which is just the tip. Okay. Number 1, leaking urine is never normal. Never, not ever. Number 2, there are easy, safe, and effective treatments to treat the 2 different types of leakage. And there's absolutely no need to suffer in silence. And you need to talk with your medical professional about what is the best option for you and your individual situation. And number 3, that bladder leakage could be a serious, there are health consequences, serious consequences to ignoring bladder leakage as a serious medical problem. Another, point to talk with your physician.
I think I don't have anything else to add. I mean, I think you greatly summarized, and hopefully people are leaving here today with this message loud and clear. Stop suffering in silence. There are things we can do that are not so scary, that get good results. And so, but we've got to normalize these conversations. And that's our goal with this, is to present things in ways that are more approachable and to speak in layman's terms that aren't so doctor and scary about things, and to get that real information. And so, I hope we can convince some of your lady
Girls,
friends and
get
them
out
in.
Get out of there, get back on the trampoline, go talk to your doctor, and start laughing and sneezing again.
Absolutely. And I gotta say, I jumped on the trampoline the other week with my little guy, and it's fun. I mean,
they're great.
They really are. Now, my orthopedic colleagues are gonna disagree with all the broken arms they treat, but that aside, it's good exercise. So.
You want to at least have the option. Get back in Zumba. Come on.
Yes, absolutely. Well, thank you, Miss Kat, and thank you, Stream Team, as always, for your love and support. And remember to show yourself some love and support. We're all works in progress, and that gives us opportunities to grow. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream Team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.